The elbow joint is made up of three bones: the humerus, upper arm bone; radius, smaller bone of the forearm; and ulna, larger bone of the forearm. The lower end of the humerus is divided into two bony protrusions known as the medial and lateral epicondyles. Various structures such as muscles, tendons, and ligaments support the stability of the elbow joint. Tennis elbow, also known as lateral epicondylitis, is a condition characterized by elbow pain due to overuse or overstretching of the elbow. The pain is caused from damage to the tendons that join the forearm muscles to the elbow. Repetitive movement of the elbow causes inflammation of the muscles and tendons that are inserted to the lateral epicondyle, one of the bony protrusions found at the lower end of the arm bone or humerus. You don't have to be a tennis player to get tennis elbow, as repeated use of the forearm and elbow for many other occupational activities such as painting, typing, and weaving can also result in lateral epicondylitis. The most commonly involved tendon in lateral epicondylitis is the extensor carpi radialis brevis, or ECRB. Causes of tennis elbow: any recreational or occupational activity that involves the use of the elbow muscles can result in tennis elbow. It is commonly seen in individuals between the ages of 30 and 50. Common causes can include improper backhand swing technique in tennis, weakened muscles of the shoulder and wrist, continuous use of hand tools such as a screwdriver or spanner wrench, commonly seen in painters, carpenters, plumbers, gardeners, weavers, butchers, and typists, lifting heavy-weight objects, poor grip when playing racket sports. Symptoms of tennis elbow. The usual symptoms of tennis elbow are pain on the outer side of the elbow, weakened grip strength while grasping objects. Pain worsens with flexion of the wrist or forearm, such as when shaking hands. These symptoms gradually develop from mild to severe pain and stiffness over a few weeks. Tennis elbow is influenced by factors such as age and recreational or occupational activities. Diagnosis. Your doctor diagnoses tennis elbow after reviewing your medical and occupational history and performing a complete physical examination. with a small camera on the end is inserted into the elbow joint. The camera displays internal structures of the elbow on a monitor screen, and your orthopedic surgeon directs the small surgical instruments to repair or remove the damaged muscle or tendon. Post-operative care. You may have to wear a temporary splint immediately after surgery to prevent arm movements. Sutures, along with the splint, are removed 1 to 2 weeks after the surgery. Your surgeon will recommend stretching and strengthening exercises to follow for a successful recovery. Risks. As with any surgery, the possible risks associated are infection, bleeding, to the joint cartilage. Tennis elbow is a painful condition of the elbow joint that results from overuse of the elbow. If untreated, chronic pain and stiffness may radiate to your wrist, forearm, or neck and cause permanent disability.